Polio is an acute viral infectious disease spread from person to person. It is primarily spread via the fecal-oral route. The polio virus enters the body through the mouth and multiplies in the intestine. If the virus enters the bloodstream, an individual will immediately exhibit a range of symptoms. Initial symptoms of the disease include fever, fatigue, headache, vomiting, stiffness in the neck, and pain in the limbs. The poliovirus primarily affects younger children, but it can also affect older children and adults. In its severest form, polio causes paralysis of the muscles of the legs, arms, and respiratory system. Spinal polio is the most common form, characterized by paralysis that most often involves the legs. Bulbar polio leads to weakness of muscles stimulated by cranial nerves. In 1% of polio cases, the virus can enter the central nervous system, leading to muscle weakness and acute flaccid paralysis. Acute flaccid paralysis is the most common sign of acute polio and is used for surveillance during polio outbreaks.
Although improved public sanitation and careful personal hygiene may help reduce the spread of polio, the most effective way to prevent the disease is with the polio vaccine. It's highly effective in producing resistance to the polio virus. If vaccinations were stopped, polio would return to the pre-vaccine levels in the United States, and hundreds of people would die from polio-related illnesses. Approximately 90% or more of polio vaccine recipients develop protective antibodies to all three poliovirus types after 2 doses. Polio vaccine is usually taken with other vaccines such as diphtheria, tetanus, and pertussis. There are signs and symptoms of vaccines that usually occur in the first 2 hours of administration, and they may include weakness, dizziness, wheezing, swelling of the throat, hives, and high fever. There is no cure for polio. The focus is on increasing comfort, speeding recovery, and preventing complications. All these are carried out through bed rest, antibiotics for secondary infections, analgesics for pain, portable ventilators to assist with breathing, moderate exercise to prevent deformity and loss of muscle function, a nutritious diet, and massage and passive motion exercises.